Can a chiropractor fix scoliosis? When discussing scoliosis with patients, most patients want to know, can you fix scoliosis, or is there a way to fix scoliosis? First of all, scoliosis is a progressive condition, meaning there's no fixing it. There's no way in permanently curing it. Scoliosis is something that you're managing throughout your life, and depending on what size it becomes. However, when scoliosis is definitely caught early enough, and especially when it's responded to early enough with a proactive treatment, scoliosis definitely can be highly treatable. There are two main treatment approaches for patients to choose between. One is called traditional treatment approaches, and the other I like to call conservative treatment options. And when we look at traditional scoliosis treatments, we understand that these are the most dominant choices that have been around for many years. And just because they've been around doesn't mean that they're the only treatment option or even the best treatment option, meaning that they're just a treatment option. And traditional treatment options' main strategy for treating scoliosis focuses around one main concept. And this main concept is when curves worsen and as they become more severe and patients kind of move into the surgical range, you start considering surgery. But little is really done beforehand to prevent scoliosis from becoming this severe level. Prior to progressing to severe, there is the most common recommendation that's normally given, and that is something called watch and wait. Watch and wait literally is no treatment. You're just watching and seeing if the curve progresses and if it becomes bad enough. And as curves worsen and patients get affected more by scoliosis, they always wish they would have treated it sooner. But obviously, you skip that because we just watched and wait. As curves progress, which is almost virtually guaranteed in every case of scoliosis, we just don't know how much is going to progress and how fast it's going to progress. We know curves can progress fast in adolescent, slow in the adult stage, but they still have a chance of progressing. And during this progressive stage, we're going to see worsening effects to the person that's dealing with the scoliosis. And then once or if the scoliosis progresses what they call surgical threshold, which is 40 degrees, and there's signs of continued progression, at this stage, they start considering spinal fusion as the treatment option. And we know spinal fusion is a costly, invasive, risky procedure that can not only cost the spine overall health, strength, and function, but it can lead to other effects in the body if there are negative effects to the surgery. So when we look at conservative treatment options, how are they different relative to what I just mentioned? Conservative treatment options are something I also like to call a functional or a chiropractic-centered approach to scoliosis. Conservative treatment values start at proactively treating the scoliosis as small as possible, because we know small curves respond better to conservative treatment, and all severe curves are one small. So if you treat a small curve, you're less likely to deal with a more severe curve. As a progressive condition, we know scoliosis always starts off mild and progresses. So like I said, treating with a small curve, you can counteract this progressive nature of scoliosis. Conservative treatments integrate multiple treatment disciplines, so conditions are impacted on every level. And every way the scoliosis can affect the body, we want to make sure we have a treatment option to help deal with that progression or impact on the person. Scoliosis as a structural condition has to be first and foremost impacted on a structural level. In fact, the rule of thumb is that if you're applying a treatment to a patient and we don't see structural improvement, we say that treatment has no effect in actually reducing the scoliosis. So chiropractic care has the ability to deal with the spine at a structural level. We know there's very specific chiropractic techniques out there that can have a structural impact on the patient's spine. We also know that the spine is also maintained not only by the bones, but also maintained by muscles and ligaments and tissues. So we know scoliosis physical therapy and scoliosis-specific exercises can help increase core strength in the spine and can have a structural impact on the surrounding muscles that help support the scoliosis and help support the spine in an optimal position. Physical therapy and SSEs can also help improve posture remodeling, improve brain and body coordination, and help achieve a more natural body position. Corrective bracing can also be very effective in this stage because corrective bracing can help model the tissues in the body and the rib cage into a more neutral alignment or into a better alignment by actually pushing the spine into a corrected position. So corrective bracing with everything we just mentioned can have a very positive effect. And then lastly is something I like to call home rehabilitation. Home rehabilitation can be a version of everything we mentioned that's customized for that patient so they can actually do exercises and therapy and rehab at home to further stabilize the spine into a corrected position. All of these treatment disciplines are very condition specific, meaning they have to be focused on scoliosis. And what's important, and this is really important when it comes to dealing with a condition as complex as scoliosis, because we know scoliosis affects the body in many different levels. So the question is, can a general chiropractor fix scoliosis, or do you have to seek out somebody or a chiropractor who focuses on scoliosis? General chiropractors can help increase spinal flexibility, overall health, decrease pain, but the complexity of scoliosis is beyond just general chiropractic. A chiropractor who focuses on scoliosis knows the spine and scoliosis and how it reacts differently than patients who just seek out general chiropractic. General patients that go into chiropractors, typically you're dealing with misalignments or subluxations or injuries or traumas. And we know scoliosis, the majority of time, isn't a trauma, isn't an injury. So injury type of care doesn't have the same impact on a patient with scoliosis. Where a chiropractor who focuses on scoliosis will use a series of techniques and manual therapies and rehabilitations and exercises to help move the spine back into a more corrected position. Scoliosis is very complex. Not only does it range widely in severity, it can affect all ages, it can develop anywhere along the spine, and there are many different curve types and condition types that could be associated with scoliosis. Scoliosis requires a doctor or a chiropractor who's trained and experienced with scoliosis with multiple treatment options and modalities at his disposal. Chiropractors that focus on scoliosis comprehensively read and interpret scoliosis x-rays, which can be measured very differently than traditional chiropractic x-rays, and they normally take into account many different angles and many different understandings in a three-dimensional manner in terms of understanding how to best help and reduce a scoliosis. So when we're looking at chiropractors, general chiropractors can treat somebody with scoliosis, but this is not the same as actually treating scoliosis itself. It's more about how the patient's responding with symptom relief and improved pain or improved range of motion. Here at Scoliosis Reduction Center, we value a proactive chiropractic-centered approach to scoliosis. And this chiropractic-centered approach to scoliosis is very condition-specific, and the goal is structurally improving the spine to make the spine straighter and reduce the size of curve. And this is done using very specific scoliosis treatments to help reduce and manage somebody's scoliosis. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.